Coming up, we'll answer essential questions about coronavirus and find out how community health clinics are innovating to meet public health needs. That's next on Black Issues Forum. Welcome to Black Issues Forum. I'm Deb Holt Noel. Despite social distancing and enforced stay-at-home measures to flatten the curve on coronavirus spread, some in communities continue to gather, assemble, and interact in public spaces without protection. We'll talk about why the current measures are so important, answer some basic questions about COVID-19, and find out how local community health centers are meeting the needs of patients during this pandemic. I'd like to welcome Penella Washington, CEO of Advanced Community Health of Raleigh, and Dr. Ibukun Akinboyo, Medical Director for Pediatric Infection Prevention at Duke University Hospital. So pleased to have both of you joining us today for this important conversation. I'd like to open up with you, Dr. Akinboyo. Would you please share what's new that we know about coronavirus? What we do know, of course, is that it is within a large family of coronaviruses, that it was first detected in Wuhan City, China, and that it is highly contagious. What more do we need to know about what really distinguishes this disease, say, from the flu, which people love to compare it to?
Yes, thank you for having me. I think you raise a very good point. Of respiratory virus we're familiar with is influenza, the flu. And what we've learned over the last 2 months in particular is that this particular coronavirus can spread rapidly, probably a little faster than influenza or the flu. And I think most importantly, we do not yet have a vaccine for it. So a lot of our prevention strategies have to be how we behave and how we interact with each other, which is a key way to prevent a lot of respiratory viruses from spreading. And one of the other issues that has come up are the outcomes around people that get infected. So knowing that a lot more people need to be in the hospital, a lot more people need to be on ventilators, and unfortunately, we're seeing a higher rate of death with COVID-19 than the influenza.
And also, Dr. Akinboyo, can you share a little bit about what you're seeing in your practice and over at Duke Hospital with regard, even anecdotally, to who's coming in? You know, we're talking about the disparity that exists in increased cases of African Americans coming down with COVID-19. What are you witnessing? What are you seeing and talking with among your colleagues with regard to the increased incidence of this disease among African American populations?
So I think what we're seeing in North Carolina in particular is probably similar to what's being seen in New York, what's currently going on in Boston, what happened in Chicago. And the North Carolina Public Health Department on their website have parsed out the data in such a way that you can see how many people are infected, how many people are hospitalized, and what the number of people according to race and ethnicity, what numbers have led to death. And a startling number is that about 39% of the deaths in North Carolina have been among patients that are African American. And I think we're seeing that even trickle down to patients that are infected. So roughly about 38% are also infected. And this probably goes across all minority groups. I think this is particularly important for Latino and African Americans. And there are many reasons, which we may be able to get to some of them while we're chatting today, that this is happening. And I think Duke Hospital is no different from all of the other hospitals, that we have a large proportion of patients that are infected with COVID-19 that fit within the minority group. That may be related to underlying conditions, so things like heart disease, diabetes, or asthma, or other chronic lung disease. It could also just be that when you're in an urban setting, and looking at some of the other states where people may have a higher rate of exposure to pollution and higher rates of contact with each other because you're in a city, that has led to increased risk of spread and more infections. And I think that pattern is reflected in North Carolina. I don't think we're vastly different. I will just say that because of all the work that has been done in the last 4 to 6 weeks, we are seeing slight flattening of the curve, which is good, but we want to ensure we stay ahead of this.
And Penny, I want to bring you in now. Can you just share a little bit about what Advanced Community Health provides and what you are seeing in the surrounding community?
So, thanks for having me. So, Advanced Community Health is a federally qualified health center. We have sites in both Wake and Franklin County. And as soon as the governor made his announcement, we saw our visits drop about 80%. And what we knew was that we really had to be active in educating our patient population so that they would realize they still need to care about their primary care services. Our patients, then we started putting into place a number of strategies to reach out to our patient population to make sure that they did not discontinue their primary care services. We put together a patient page on our website. We put together a video for our patients to explain to them how to talk to their provider through video teleconferencing. And so we put into place telehealth. We quickly found out that a number of our patients do not have access to internet, or the platforms for telehealth were pretty complicated. And so we put Wi Fi into our parking lots of our practices, and our patients can drive in and they can take a parking spot. We hand them an iPad and they have virtual visits from their car in the parking lot. We also started curbside pharmacy so that patients can drive up, and we have runners back to our pharmacy inside, but they do not have to leave their car, and we do the whole transaction so that they can keep up to date with our pharmaceuticals.
Well, clearly you are taking steps and enacting measures to try to serve your population and kind of meet them where they are. That's really significant that you would experience an 80% drop in appointments coming through. And so you are taking steps to try to cover that digital divide. And you mentioned that the education component is so important. Let's get a little bit more education on coronavirus out there. And I want to address this to Dr. Akinboyo. Can you just share a lot of what is being instructed out there is the hand washing. And I know that that is basic, but there's the hand washing and then the sanitizer. Can you talk about why this focus on washing your hands?
Yes, I think the focus on washing our hands should exist no matter what. But in particular, right now, more than ever, our hands are a way in which we touch and interact with the world with our hands. And quite often, more than we're even aware of, we touch our face. And anytime you touch your face, your nose, your mouth, your eyes, you have a risk of moving whatever it is on your hand. In this case, we're trying to limit SARS-CoV-2, the virus that causes COVID-19, trying to limit that from moving from your hands to your mouth or nose, because that is a way of contracting this infection. So in this context, we know that if you wash your hands appropriately, if your hands are soiled, if you can see visible dirt, the recommendation is soap and water for at least 20 seconds. It's hard to keep track of 20 seconds. You can count to 20, sing a song, or talk to somebody as you're washing your hands, or use hand sanitizer. There's really no difference, I would say, between both. I think I prefer hand washing when I can, which is using soap and water. But when you're out and about, when you're just in different rooms in the house, it's a little bit easier to have hand sanitizer because it's quicker, faster. You can just put a dollop on your hand as you move around. But amongst all of us, we need to do a basic thing, which is just hand washing, and we think everyone can participate in this, and that's why there's so much emphasis on it.
And I would just want to stick with that for 1 second more, because my understanding, and correct me if I'm wrong, is with the hand washing, is it the warm water, or it's the soap that's breaking down what we know about coronavirus? And then also comment, Dr. Akinboyo, about what kind of hand sanitizer, because people are getting the wonderful all natural hand sanitizers imported, etc. how effective are they against fighting this particular strain of coronavirus?
Yeah, I so appreciate you bringing those 2 points up. I think while we can just put our hands under water and you can wipe off visible dirt, what we're talking about here is really getting soap on your hands and rubbing them together. And the CDC has numerous videos around this because the soap breaks apart things on your hands. Viruses are included, but including just other things you don't want to put into your mouth or put on food or touch someone that's immunocompromised, has a lower immune system, that can then catch this infection. And then you had a good point about hand sanitizers as well. There are a lot of scented hand sanitizers, things that are all natural. There are things that are out there. I think until we know more, we have to go back to the basics. And the basics include using a 60% alcohol-based hand sanitizer. And you can just turn the container around to read the amount of alcohol content to see if it meets that. And if it does, go ahead and use it. If it does not, I think I would defer to the manufacturer to ensure that it meets at the very least, the Environmental Protection Agency standard for cleansing or disinfection for anything you're using to clean your hands or clean the environment.
Thank you so much. And Penny, I'm sure that you are providing instruction to the patients who come through Advance about how to protect themselves and the hand washing and so forth. But can you talk about the importance of maintaining the wellness visits during this pandemic?
Well, the thing that we're the most concerned about is so many of our patients have multiple chronic conditions. A good number of our patients have diabetes, hypertension, COPD, asthma. So many of the things that make the immune system weaker, we see as our patients. And so we're not only educating them on washing your hands, etc., but really talking to them about not letting their health decline during this time. Take, for instance, the diabetic. We want to make sure that they don't see that this is a period of time that I can eat anything I want to because I'm staying at home and COVID-19, but that they have to maintain their health during this time. So we are making sure that our diabetes educators are reaching out to our patients, that we are doing everything to continue to communicate to them. Here is the impact of your healthcare condition, whatever it is, on your body. We need to make sure you stay well. We need to make sure you stay out of the emergency department or the hospital, especially at this time that those hospital beds are so needed for COVID-19. So a lot of work is being done to reach out to our patients to make sure that they understand the importance of their wellness, of their preventive care, and keeping up with whatever their treatment regimen was before COVID-19 throughout this period of time.
So now is not the time to social distance from your doctor. You have to keep your appointments up. I want to talk a little bit about another population that people may think is safe, and that is the children, the younger people. Dr. Akinboyo, I want you to talk a little bit about how we can detect, if possible, sign of coronavirus in children, and what to do if you suspect your child has it. It's so difficult, from what I understand, because many of them are asymptomatic.
Yes, kids are quite often the vectors, and what that means is they share viruses around the community. Yet, in this particular pandemic, what we've noticed is we're seeing a slightly different pattern in pediatric patients, so in younger kids. And it looks like they may have the infection if we actually detect it and have extremely mild symptoms that sometimes we may miss it if we didn't happen to be testing them for whatever reason. And so in this case, I do think the symptoms everyone's aware of, so cough, fever, shortness of breath in children, it may be some difficulty breathing, or complain about tiredness out of proportion to just the amount of play they had that day, or sore throat, and then some GI symptoms. What that means is maybe diarrhea, abdominal pain, may be the presenting symptoms of COVID-19. I don't think that we've seen a ton of children needing to come into the hospital and require ventilators, but there are still a few that do. And so it's still something that I would recommend calling your physician ahead of time or calling your healthcare provider so you can talk through what you're seeing. And similar to what was just mentioned, I'm always excited to see all these newer ways to try and get patients access to care. There's so many ways that are out there in whichever healthcare facility you usually go to, and they can evaluate a child either via video, on the phone, and then sometimes in person if that's needed, and evaluate them in a safe way and test them for COVID-19 if they need to. I should also note that a lot of kids can get this infection and safely stay at home. And we have some guidance and some educational resources on how to take care of a child or anybody really that has COVID-19 and has to remain in the household because a lot of people have mild illnesses.
And to take care of them at home, what is needed?
So as long as you it's a luxury to be able to care for someone at home and care for them in isolation, and we recognize that not everyone has access to a separate bedroom or a separate part of the house, but if you do, I think this would be a situation where it's ideal to try and cohort the person that's sick into, you can label it as just a sick section of the house and ensure they're using a separate bathroom, using separate utensils, and they can eat the same food, but they shouldn't really be the one preparing the food, particularly when they're sick, because that's the highest time they can transmit the virus. Every other thing, making sure they stay hydrated, making sure fevers are controlled, and they stay well fed is important for them to get better. But other than limiting the spread, there are no additional measures that need to be taken at home. If you see any signs of change in their awareness, so they're not able to recognize people, they're confused, or high persistent fevers, those are reasons to bring someone that's sick at home to the hospital.
Thank you. And Penny, certainly the community health centers serve uh, the needs of entire families. At the same time, it was mentioned there are older caregivers often of of younger children. So, what are you seeing in your clinic, and is there any advice or guidance that you are taking or offering? Any measures that you all are enacting inside your facility to try to provide for that?
So we have created what we call pods within our physical facilities, and they are tents that are set up with that a person would come into a tent within our lobby, and all of their care is given within that tent. So there is a iPad for communication. Our staff would put on protective equipment and go, and whether it's an immunization or they're giving a COVID-19 test or whatever they're doing, that happens within a pod. So every patient is completely separate from another patient. And then when that patient leaves, then that whole area is wiped down. I just want to comment that with especially the kids, what we are seeing is being home and being confined is not very easy for people to do. And so it's also bringing out another aspect of our practice and practices all over the country, that mental health side of things. We have licensed clinical social workers, including one specifically for pediatric patients, that help them with those fears and concerns and other kinds of issues that come up around COVID-19. Because so many things are unknown, it just you can build up all of these concerns that it's good to have somebody to talk through those with. And that's one of the reasons why we have licensed clinical social workers, and especially one for the pediatric population.
That is good because there's another area of that mental wellness piece is just loneliness.
Yeah.
Because
Yes.
people are being told to isolate, particularly maybe grandparents and grandchildren. They're not able to see each other, and even children are having to try to understand um, why they can't be with friends. And it's not just children, it's teenagers too, and probably adults. So so as we're looking at the mental health aspect of that, it's good to know that that service is there in advance. And Dr. Akinboyo, are you all witnessing or experiencing um, patients who are having some challenges with just just coping, not with the fear, but just with the loneliness?
Yes, we're seeing that. I think we suspected this would be the case, and there tends to be a shift now from social distancing to physical distancing because we're all humans and human interaction is important for all ages. And it is hard to pull a 2-year-old back from going to see a grandparent, even if they're just standing across the street. But amidst all of this, we realize that our long-term goal is to prevent, to keep people around long-term so we can get to a point where we can hug them and see them in person. And to achieve that, I think reaching out for virtual resources, so healthcare workers, some visit with mental health providers. But I think also some of the basic things that we may not have done as much as we should previously, sort of calls and video chats and ensuring that if there are opportunities to physical distance but use all of the technology that's available to connect with people, I would advocate for it.
And I
And
want
going
to
back to, oh,
And I'd
go
like to
ahead.
ask the both of you about testing, because it seems to be this elusive thing. There are different kinds of tests. What can a patient or person expect when they come to get tested for coronavirus, Dr. Akinboyo? And then I'll hear from Penny, about the testing that's available at your center.
Yes, so please come to the hospital if you're worried because we have access to tests. And for the most part, most people will get a nasopharyngeal swab. You've probably heard it commonly referred to as an NP swab, which is a soft, almost a Q-tip looking device that goes into the nose and it's swabbed around and sent for SARS-CoV-2 testing, the virus that causes COVID-19. Most other people would not require anything else, no blood test, nothing else. But if you're in the hospital, there may be additional testing. And for any other reason, if you do feel like you need to come to the hospital, even if it's not directly related to COVID-19, we're encouraging people to still do that. You can call ahead of time because we don't want to look back and realize that because we focus so much on testing for COVID-19 that we've missed other common infections that are still in our community.
And Penny, what kind of testing is available at Advance?
So at our sites, we have DriveUp Testing. It's the same nasal test, the nasal swab. Down the road, we're really hoping that we'll be able to do the antibody test. But right now, the only test that we're doing is the nasal test to determine if you have COVID-19. And we do it at all of our sites, quick in, quick out. But it's surprising that we are not seeing as many people as we would think that are coming to get the testing. I don't know if it's because people really expect that to take place in the hospitals as opposed to their primary care practice or their doctor's office, but many doctor's offices are doing the test. We just need to make sure we have enough protective equipment ongoingly to be able to continue to do it.
And if someone shows up for testing at your clinic, Penny, um, what do they have to prove? Or are you turning people away at this point?
We, if somebody calls, which we prefer for them to call, we will ask them if they're symptomatic. We would prefer to save the test for those people that are symptomatic. However, if you come and you're really worried about it, we'll go on and test you. We will not turn you away. But our preference is that people call our main line at 919-833-3111, and we can prepare for that visit.
And Dr. Akinboya, is that the same at Duke Hospital?
Yes, and I can provide those resources so it's available for people. We have DriveUp Testing. There are multiple clinics that have testing. You don't actually have to physically walk into a hospital to get tested today. So if you're worried, there are many rapid testing sites that can get you in line and get you tested. It is important to call a provider ahead of time because the test order actually has to be put in so we can follow up with you and ensure that we're giving you resources to manage any symptoms that come up. But there's so many ways to get tested, particularly in North Carolina, and we're happy to share that information in whatever format that's helpful.
Great. And I just have like one last, Dr. Akinboyo, a question about food. About 30 seconds. Is it safe to get the food from curbside and get takeout and so forth?
Yes, don't forget to wash your hands after you open a package and before you eat and put food in your mouth. But yes, this virus is not transmitted within food, particularly cooked food, but you can get packages. Just ensure that you wipe your hands after you touch anything at this point.
Terrific. Thank you so much for that advice and for taking the time to be with us. I'd like to thank Penella Washington and Dr. Ibukun Akinboyo for their time and advice. For information about today's program, please visit us online at unc.tv/watchbif. Thanks to all of you for joining us today. For Black Issues Forum, I'm Deborah Holt Noel. Stay safe and be well.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC-TV.